Welcome to the Matrix Revolution show right here on YouTube and other social media. This is Mike, and today I am with another local business owner, Amber, and we are in Port Charlotte. So tell everybody, what is your full name?
Amber Eggerson.
Okay, I'm asking your full name because if you don't know Amber, she has a lot of letters after her name. So tell us what you do, what all those other letters and initials mean after your name.
On my credentialings, so I have a master's degree in occupational therapy. I'm a registered occupational therapist. I am also a certified lymphedema therapist, been for about 10 years. And then I also have an advanced MLD certification that specializes in post-surgical care.
Okay, so the government thinks that she definitely knows what she's doing. She's got all the letters to prove it. So what is your current business?
So my current business is I own a lymphedema clinic, nonetheless. So we specialize in treating people with either medical diagnosis that they need lymphatic drainage for, or if they recently have had a surgery. And we're also specialized in detoxing people.
Yes. What is the name of your business and where is it located?
So business is Lymphology. I'm located in Port Charlotte, Florida, 1620 Tamiami Trail, Suite 216. We're in the Murdoch area in Port Charlotte.
Okay, we're actually in the office now. If you can see behind us, we have this beautiful giant waiting room, and there are two other medical rooms, I guess treatment rooms that you can get things done in. So let's talk about what are the type of women that come here. I know typically there's a lot of women that come here. I know men come here too, but tell us about the type of people that come here and why they come here.
So we do treat a diverse amount of people. I would say 50% of the the clients we have come in for post-op care. I'm certified in dealing with people whether they've had cosmetic surgery or if they've had a medical procedure. So we do get like postpartum women if they've had a C-section or even if they haven't. So most of the clients come in for surgery, post-op care. The other remaining part comes in for detoxification, and that can be for if they've been on a lot of medication recently or if they're sick and they still have some of the symptoms lingering. We also treat people medically as well. So I get if you have lymphedema, lipedema, autoimmune disease, anything that can cause the lymphatic system to become sluggish and retain fluid.
Okay. So can you come here on your own, or do you need to be referred here by a physician?
So you can come here on your own. Since we are a private paid clinic. So you can come directly towards us. If you've had surgery, typically doctors would like to either recommend or not. We prefer a doctor's referral. We don't need one, but we just need to make sure your doctor is approves you of getting lymphatic drainage.
So the big question is, how did you even get into this particular field of medical?
So I decided about a little over 10 years ago. I was working in home health doing OT, occupational therapy, and I have had several clients that were cancer survivors. And I've had a couple other clients that I noticed they had lymphedema in their legs and they just weren't getting adequate treatment. They were crying all the time about how heavy it was. And as an OT, my job is to figure out how to add quality to your life, how to add value back. And there was such a lack in this community. So I did a lot of research and I decided to go back to school. I decided to go get the certification and become certified as a lymphedema therapist.
Let's go back. So somewhere between high school and now, you had a medical calling, or was that something that your parents kind of forced you into?
So I've always been geared towards doing medical. I just didn't know it would lead to this path, but medical it's in my bloodline. My mom was a nurse, and we do have some other medical professionals in my family. I choose medical because I just like to help people. I genuinely want to help others. So medical was the path I knew I was going to be on. OT just happened to be the path of how I service people.
Okay. So the other question we're going to have is, we have a business. We hear about lymph node drainage. So I don't know if people think it's some kind of medical procedure that involves needles and taking things out. Is it involve any kind of apparatus where you're draining it, or is it a massage style drainage where it comes out on your own?
So good question, because a lot of people, when I tell them I do lymphatic drainage in the office, they think I have like a giant needle, and that's not true. So lymphatic drainage therapy is non-invasive. It's a non-invasive therapy. I use manual techniques. So we use our hands we use our hands for lymphatic drainage. We use certain techniques. I know, right? Of course, right? So we use
Not that kind of spot.
It's specific training. So a lot of people kind of refer to it as a massage, and it's really just a very different technique. It's specifically how we move, like the direction that we move your body part, and like the direction we move the fluid to get it to go through your lymphatic system. As far as apparatuses, you can use a couple apparatus, and in the future, this lymphology, we plan to roll out a couple of different techniques and apparatuses as well to help enhance the lymphatic drainage experience.
Okay. So I also want to know that if you're, excuse me, okay, so you have those services. What's the procedure? How does somebody even get lymph nodes? How do they get clogged? I know if you read on the internet, it's typically deodorant and bad food. So what is your professional opinion on how does somebody get to this point where they needed to get drained?
Well, so that is a valid point. It's really bottom line what it comes down to is there's a couple of different factors. Toxins is definitely one. That's how I would say the average person is getting it clogged. And toxins can be from the air we're breathing in, pollution, chemicals that we're either ingesting through our food and beverages or absorbing on our skin, which would be makeup, perfume, cologne for men. Also deodorant plays a huge part in as well. A lot of those things that we're using on a daily basis, body wash, toothpaste, all those contain ingredients. I know we've all experienced that. Like you're looking at the ingredients and you're like, what is that? You know, they all contain all these ingredients that we cannot pronounce, nor do we know. All that is toxins.
Okay, so pretty much life in America, daily life in America is causing you to need this service. So we want to help our listening audience. So what is maybe one or two things we can do to maybe improve? Let's start on the personal care. Let's go we're going to shampoo, we're going to soap our bodies, and then maybe put some deodorant or perfume cologne on. Can you go through that process of maybe what the better way to do that is? What should we be washing our hair with, body with, and then what do we do to not smell bad?
So you really have to be diligent in reading the labels. You have to look and see. There are like natural shampoos and body wash out there. Some people don't like them. You know, some people enjoy the fragrance and all that, but they actually work very well. They get the job done, and it's just a natural state. Vinegar is a great natural thing you can use to like wash your body. Apple cider vinegar is great for the hair as well. So I would recommend looking at the label and just try to get something pure, like Ivory soap that has less going on in it. Yeah, it's just pure. There isn't any like fragrance, there isn't any dyes. It's just pure soap. So that is actually much better than something like Bath and Body Works. No offense to them personally, but there's a lot of different toxins and chemicals in that.
Are there a lot of toxin chemicals in the specialty soaps, like your oatmeal soaps, and maybe some of the ones that are specialty and become the giant square that you get at maybe a farmer's market? So
again, this is where you have to read the label, because sometimes the farmer's market, you would think it's actually clean, and sometimes it's really not. So there are really actually great clean soaps. You can do oatmeal soap, there's goat milk, there's other options, but you just have to look at what they're actually putting in there. Like we all have to do a better job with paying attention to what is in our soap, our shampoo and our soap, which is crazy, right? You think that you only have to pay attention to what you're putting in your mouth, but our skin is our biggest organ.
Yeah, it's a big absorber.
A huge absorber. So you can't help like the pollution and the air and stuff you're breathing in, but certain things like that you can help. So just read the labels. Make sure it's, you stay away from anything that you can't fully understand. A lot of petroleum is in a lot of things as well, and that actually does a lot of clogging too.
Okay, so you don't have an issue now, so let's make sure that we don't. We want to set up an appointment. Can you run us through the process of setting an appointment and what happens during your assessment?
So you would come in, like if you're, I will ask you simple questions like, tell me what's going on. So the average person will say, I don't know, I just feel really sluggish. I have brain fog. I have little aches and pain. Like I'm feeling a little lower back pain, or I feel really tight and bloated. So you would make an appointment. I'd have you come in We'll do like a consultation. What we do is we kind of just assess your nodes. I go throughout your body, assess your lymphatic nodes to see what feels clogged, what feels like it's open and flowing. And then I just lightly feel around your body. And that can give me an idea of if I'm feeling fluid, what area I'm feeling it, if it's moderate, if it's severe. And then we come up with the plan. Based on how severe your fluid is, I will let you know this is what's recommended. And whether it's frequency, the amount of like the frequency or the time length, because some clients require longer sessions than others, and that's all just based on what we can find and going on with you.
Okay, so we highly recommend that you make an appointment, get your assessment, make sure that there's really hopefully no problems, and if there is, you can catch them nice and early. And we've talked to some of your previous clients, and they were saying that 1 or 2 sessions, 100% difference. So do you want to talk about maybe some element someone comes here with, and then how you've saved them with getting that pain-free lifestyle within a couple of sessions?
Yeah.
Do you have a good story you want to tell us?
So I do have one in particular, and I know she's on here as a testimonial, but I won't disclose her name. She is a breast cancer survivor. So she's from Chicago. She started seeing me almost a year ago, December of 2023, and her arm was extremely, not only was it large, but it was hard. Like, I mean, it was from mid forearm all the way up to about the middle of her tricep. It was like literally rock hard. And when she came in and I did my assessment, and she said to me, "This is the worst my arm has ever been, and I'm really scared." And I told her, I just simply told her, "Relax. You're in good hands. We're going to be fine." I educated her on what to do on her own in between our sessions. But within about a few weeks, we were able to get it softened. So within the first session, she noticed a huge difference because we were able to get some of the fluid to move. However, when it's like rock hard like that, it's just difficult it's just so clogged and so backed up. It's difficult to get a lot to move. So within a few weeks, the floodgates open, and she was, she just reported her arm felt normal again. It wasn't feeling like a brick. It wasn't rock hard, and it wasn't as heavy. And now we got her to a great place where her arm she's down a compression size. It's almost unnoticeable that which arm has lymphedema in there.
That's an amazing story. So you said it's hard. Now, is it a liquid like water, or is it more of like a thick like oil syrupy? How does that work? What are we draining out?
So good question. Lymphatic fluid is different than water. Most people have this notion that you're retaining fluid and it's water. It's not necessarily water. Fluid is a thicker component. So fluid contains, like lymphatic fluid, it has like adipose tissue, and it has proteins, it has waste, it has different other components besides water in there, which makes it a little bit thicker. So in someone, like in her case with lymphedema, what she actually has is what they would call like fibrotic buildup. And what that is like really, really an intense amount of protein that is built up, and it causes, in the beginning stages, it kind of feels squishy, like a memory foam mattress. And then as you progress and it gets worse, it becomes extremely hard, like a rock. So in her case, she had a lot of fibrotic buildup. And somebody else who doesn't necessarily have a medical condition, it wouldn't be fair to call it a fibrotic buildup, but it would be fair to call it just a really thicker fluid that needs to move.
So when it is moving, at some point it goes out of your body. How does it release out of your body? Is it going through the pores?
So when you get like a manual drainage, right? When we manually drain it and we run it through your lymphatic system and your lymphatic nodes, what it does is it actually goes back through your bloodstream. Okay. So the fluid, we send it through the areas it needs to go through. It goes to the bloodstream, and then it goes to the kidneys and liver, where they filter out the bacteria, the waste, the toxins, and then it goes out your urinary system. You just excrete it out.
Okay, that sounds fair. So I guess that gives out of that vision of, like I said, manual and a bucket of just slime coming out of you. So it's just a natural process. So there's no needles involved, no just hands and natural drainage.
Yeah, just hands and a specific technique. You can add in other apparatuses, as you said, and we do plan on incorporating some later, but you really can just move. I have great success with just my hands alone. Okay.
Is there any age group that should not come here? Is this also good for children with this, or only adults?
So it is. There are sadly, there's babies that are actually born missing lymph nodes. So you do have children who actually end up with lymphedema. I would say the youngest person I probably treated over my career, she was probably 25. So age doesn't necessarily play a factor. It's just how is your body handling your lymphatic fluid. And that can affect any age at all. And it affects any age. You don't necessarily have to have a specific medical condition. It could be just someone like you or I, like I'm just dehydrated, or I'm wearing makeup and perfume and using crazy hairspray. It's just as simple as that.
Okay, so any warnings with the women that have multicolored hairs, like the purple green hair girls and the shiny makeup, and are they at higher risk just because they're doing that?
They are. All that stuff has toxins in it. And I don't tell people to change anything. You live your life how you want to live it, but you might want to consider a way to keep up your health and your wellness is to get regular drainages, get regular lymphatic drainages to kind of counterbalance all the toxins your body's absorbing and trying to process. Okay,
so tell everybody how they're going to make their first assessment appointment with you.
So you can make your first appointment by calling. You can call us. Our number is 941-888-4544. You can also go online, lymphology.net, and you can book a consultation if you like, because if you're not sure what you should book, you can just do the consultation, come in, and then we can give you an idea.
Okay, and then the approximate investment for that was how much about?
It really varies, just depending on what you need. So it depends on how long the session is going to take. I hate to throw out a price because every person's different with what they're going to require.
So initial investment would be like going to a regular doctor somewhere in that. So I treat it like about an hour, and then whatever your investment is for the day.
Yeah.
No problem.
Okay. I was like, can we just pause there? Because I really don't know how to answer that. It's really difficult to put it, because someone who's seeing me for post-surgical.
I'll say for the first time, just to get an assessment.
Oh, just to come in a consultation.
Yes. Consultation.
Consultation's $25, and if once you sign up for a service or a package, that credit goes back towards the package.
Okay, so for $25,
it's virtually free.
Let's go. Yeah, basically that's a lot of time. So let's get you in here. Let's make sure that you're well, and if you're not, let's get a treatment program for you.
Yes.
Okay. So if you're dyeing your hair, do that. So any genius statement before we end our interview today?
A genius statement.
Tip, trick, things we can do.
I would say the most thing is people really need to take their lymphatic health serious. Every disease starts from a point of inflammation. So if we can remember that, and we can remember that inflammation, especially long-term in the body, leads to other serious medical conditions, you would be better off. If you can just take care of it now, nip it in the bud, keep it healthy, keep your lymphatic system healthy, you can save yourself a lot of issues down the line.
Okay, so thanks you for watching.
Thank you.
And make sure you visit her website and also grab that assessment.